amendments attached, all these amendments. Tell us why.
Okay, so if I could start, there were 4 bills that had a lot of support in the Senate. The first was Senate Bill 68. That's the governor's bill that Senator Hennessy introduced for him on pregnancy. I believe he retained it. There was no opposition to the bill, except for one out-of-state attorney that just raised some questions that were resolved. We had the executive director of the Human Rights Commission, Ms. Malachi, write the bill. It was caught up in House Bill 1234 last year, so it got vetoed. So it's been through the process twice. There was no opposition twice, and we were a little bit perplexed as to why it got retained. That's number one. Number two was Senate Bill 69, the breastfeeding bill. There's been a huge amount of work over the years on that bill. Consensus support, again, no opposition to that bill. Clearly, both of these bills, the pregnancy bill and the breastfeeding bill, are very important workforce bills to make sure that people have, the opportunity to work and, whether it's breastfeeding or pregnancy protection. So that bill was retained also, and reflects with that. I'm going to let Senator Sherman speak to Senate Bill 59, but I would just add the piece in, I think it was Senate Bill 86, dealing with the land and conservation issue for housing. Again, had broad support in the Senate. It had been, unfortunately, the program was repealed 10 years ago, was reinstituted, but with no funding. At a time that affordable housing is as in short supply. Many of us think that that's an important bill. So we ask for your consideration on those 3, and I'll let Senator Sherman talk to his bill, which was 59.
May I go first?
Absolutely.
I'll be really quick. So one of the things I like as an attorney is the use of the word reasonable and sufficient, and again, reasonable. So they're accommodating the employer. Depends on what you have. It isn't, we're not giving you a one-size-all thing. It's very adaptable, very flexible. So I just like the language in both section 29 and 30. I'm sorry, Senator Sherman, go ahead.
No, it's fine. First of all, I am fully supportive of 68 and 69. I think they're phenomenal bills. I think they've had strong bipartisan support, and I agree completely with Chairman Bradley that they are really critical for workforce, especially as we look at the impact on women and COVID. COVID has had a disproportional impact on women. We need to get them back in the workforce, and especially with our unemployment rate being impressively low. So that being said, those are my highest priorities. Senate Bill 59 passed the Senate 24-0. We are in the middle of a mental health crisis, and Senator Bradley will attest to the fact that we've been listening to the carriers say we cover it already, and they don't. That's fundamental here. They don't cover it. So this is the standard of practice in psychiatric care. The benefits to the state would be, number one, workforce. We have one of the most challenged psychiatric workforces in the country. We cannot recruit and retain, partially because of our size. Most of our psychiatrists come out of the Dartmouth program, which is a wonderful program. But this is critical, not only for ease of access for patients, it's also important for workforce in terms of the availability of psychiatrists, and it ensures that this model will get reimbursed. And as a doctor, over and over again, I've heard from the carriers that they cover it. They don't. Well, this is on all sorts of issues, but on this one, that's what we've been told. And so at least 5 states have instituted, put it into statute so that it would be important. You know as well as I do that we've been working for years trying to make sure there's parity. It's part of the 10-year mental health plan. This dovetails perfectly with the mental health plan. It dovetails perfectly with the integrated delivery network, which we've spent an awful lot of federal dollars, at least $50 million that's closing up now. This is the model that we need. I understand that they are saying that they cover it. If this shouldn't pass, if for whatever reason this does not make it through this process, then the next step for me will be to make sure that we're documenting any failure of coverage. But again, we're in the middle of a crisis. We don't have time to wait and see if the carriers are going to cover it. We've seen in other areas like ER boarding, they don't cover it. They say they do and they don't. SB 70, which we held on to in the Senate, was an effort to make sure we hold them accountable. And, you know, on all these bills, I think this is critical. I think it's important that we address the mental health issues. I understand the concerns of the chair. And I would ask that we consider this. That's it. I think this is a critical part of our response to the mental health crisis.
Okay, well, we'll start with that one. I mean, we need the evidence that they're not, I mean, who are we us to say that they're liars, so that they tell us that it's not true. So unless we have evidence. So yeah, we need to build a case. I mean, clearly you could put the bill in again, come next January. You know, and I would just say you need to have some evidence. You need to have it.
Well, we have
And I would hope that the insurance companies have heard this, and that they heard you, and that they will make sure that they are covering it. And to me, that would be even more effective if we get them to cover it without.
I would be 100% in agreement with that. I would love to see that happen.
Okay, next we'll take these two.
So let me just, if I could add
Oh, you want
to
to talk about that one?
59,
Okay.
yeah.
Okay.
You know, I think it's really important. I'm looking at the hearing report of the Senate when we talk about evidence, okay? The support for the bill was overwhelming from, you know, folks in the field. Patrick Ho of the New Hampshire Psychiatric Society, Michael Padmore, the Medical Society, Sabrina Dunlap from Anthem, Jake Berry, New Futures, Paul Minahan, Hospital Association, John DeJoy, National Association of Healthcare Workers, Courtney Tanner, who's here from Dartmouth, Ken Norton, for NAMI. No opposition to the bill, none, zero. And I think that, you know, Senator Sherman, you know, is pretty well connected in the medical field to what's actually happening. So we were kind of mystified with the kind of support for a model that has no opposition. Having it in law makes it clear that reimbursement for this model of collaborative care, which allows more participation by different healthcare workers at a time that we know we have shortages, in particular of mental health workers, is pretty important. And so I think that you know, the fact that folks that we all listened to, who I just cited, had, you know, universal support from the carriers to the healthcare professionals. I just, again, it's mystifying why we didn't move forward.
Yes, I have to agree. You know, 59 was one that we did hear from both sides, while there really wasn't opposition to it. And the fact that many of our patients they see their PCP and they have a closer relationship with them than they do with mental health professionals. And if they can work together, if medication is necessary, if counseling is necessary, and it keeps them from having to go to another provider, which in some cases would prevent them from getting further care. So, you know, certainly I think and supported 59 and would like to support 59 here.
So the issue really is that if it's already covered, then why do we need to put it in the statute?
I would agree with you, but we're, certainly what we have heard, I think Senator Sherman more than anybody else, because he is in the field every day, different practice, obviously, but really well connected. People are telling us, no, it's not covered. And we, as we'll probably see Senate Bill 70 next session, we keep hearing things are covered, but then we keep hearing things are not being reimbursed. So I think we all know that we need to get to the bottom of it. It'd be one thing if there was any opposition to the bill. There's not. And that's the
Well, I
fundamental
mean,
for
I
us.
say there's no opposition to the bill because it's already law.
It's not law.
I mean,
It's not law.
It's already policy of the interest, from the state. So there's
That's,
already.
and that was the testimony from Anthem, but then we hear the people aren't getting covered for this model of care, that there's no opposition to the model.
So that's
And
what
it's
we need-
already
we need to see that.
reimbursed for Medicaid and Medicare. So again.
Right, but I'm sure they don't have it in the rules that that's just been covered. So what I'm saying is, why would we want think? I mean, there's a lot of things out there that you say these are mandated things that are being covered that we should have in the statute. We only put things in the statute is when we actually have evidence that companies are not doing.
We're missing the big picture when we sort of get into that kind of detail, whether it's in the statute or not. We believe it's not being covered, despite some of the assurances you've gotten, and there's no opposition to having it in statute. So whether it's in statute and not being enforced, or whether it's a practice but not being enforced or being reimbursed.
Or whether patients have to advocate for individual care, I think that's a problem. Because there are many that won't be able to advocate for themselves.
If I could just add, we do have things in statute. Unfortunately, it's usually in psychiatry. We have parity bills in statute because there was not parity. And in the Senate hearing, we heard that, yes, as far as we know, Anthem covers it. We don't know that all carriers cover it. We heard from Heidi that it should be covered, and that's why they were actually on board with it. This sets the standard of practice in psychiatry. I agree 100%. We don't need to put standard of sedation for colonoscopy in statute. It's covered, it's done, and but in areas where we have deficiencies, where we also have a crisis, it actually is a role for statute, and we've done that. There is a precedent for it in psychiatry, in the parity. This is part of the 10-year plan. This is part of how we respond as a state to the fact that we still have people boarding in our emergency rooms.
Obviously, we have to uphold the House position. The House did vote on this particular bill.
Right, but with further evidence that I think we presented today, we would hope that with no opposition to the bill in the middle of a mental health crisis where they're clearly, we've gone to the ends of the earth with financing. Thank you for acceding on, or concurring, on 143, a licensure bill. Hopefully the secure psychiatric hospital gets funded in the budget. So I just see no reason not to move forward with this bill if it's just, to uphold the House position. I get it because I've been in your shoes, but I hope that you can understand that in the middle of a crisis where we're trying to move heaven and earth to get resources to people that need the resources for mental health counseling and treatment, that you would reconsider. It's really important to us.
Bring it in again next year with some evidence.
Well, if you
Bring it in next
promise to sponsor it with us, that might.
If you bring me the evidence, right, you gotta just show me the evidence. So show me that the insurance companies are not covering it.
But show me the opposition to it, and I would.
The opposition is in terms of the
But that's a
committee.
nitpick.
The Commerce Committee.
Excuse me, that you're nitpicking us in the middle of a crisis, that when there's no opposition to a care model, and it's important to have it clear for reimbursement purposes, the fact that you know, you're holding on to a position because you voted it down. It just, I understand the dynamic of it, but it just seems in the middle of a crisis, there'd be a little bit more open-mindedness.
My final comment is, okay, when you say care model, okay, as what little I know about health insurance, everything is driven about what are the standards of care, okay, and the standards of care, which is generally accepted practices. Okay? If you say 4 states have done this now,
I think it's 7 or 8.
okay, so the issue really is that in terms of what is going on in the nationwide, is this an actual state of care? If the insurance companies are telling us it is, and we have no particular reason not to believe them, unless you can find evidence to show us where the refusals and that it's occurring and that we can't correct it, then I would say yes, then it's worth, then you need to put it. But the idea of putting in this model legislation that's supposed to be the standard of care that everybody should be doing is a problem for me, because there would be a lot of that stuff we would stick in the book. So then it just becomes, more mandates that nobody reads or care or evidently following or something. I don't know. So and our attitude is right now is that if we need, show me evidence that it's not happening. Okay, let's go on to 68, 69. Okay. The problem the committee had with 68, 69, and I'll have to be frank, my druthers would have been that we didn't even have these sessions. We just retained everything and wait till September and have our session then. But of course, that was just my personal opinion. When it comes to the Commerce Committee, as you probably know, we do a lot by subcommittee. In fact, we do every bill by subcommittee. Every bill would have another opportunity to have a little discussion before, so that by the time we get to the full committee, we pretty much know where we're going with it. I made a commitment that we would not have any subcommittees this year, because the idea of doing subcommittees on a Zoom session just didn't seem right or workable. We like that pre-throw communication that occurs. So the reason we retained these bills were that the committee members definitely had questions, and there's some of the words were being used, legal words and things that people wanted to make sure they understood the consequences and understood it. And then the comment came out to that the Human Rights Commission is actually doing it already, so that they don't, so why are we passing a statute if they're already doing it? That they already have the authority, that when we created the Human Rights Commission, they had the authority to implement. So when that piece finally came out, that was okay. They threw up our hands and we said that let's just retain these two and work them through this come September, and hopefully we'll have something, to get out of committee, come, be on the floor next January.
I think I have to take exception with some of what your recall is on that, Mr. Chair. We went through both of these bills previously, and they were passed, both on voice vote, and then they were lost in the COVID omnibuses. These haven't changed. They've been worked on for both 68 and 69 have been worked on over and again. There's a tremendous amount of support for them. We had huge numbers of testimony on both of them, and the questions really came up from new members of the committee that weren't involved in all of the work we did in it in the past. So I think, both of these bills are ones that a tremendous amount of work has been put in. It's really important to, as Senator Sherman was saying, about getting women back into the workforce and feeling safe, that they can be nursing or can be pregnant. And there's accommodation in the bill that if it's a problem for the business, then they can give cause that something they may not be able to comply with would still be considered. So I certainly hope that we would move forward, because the sense in the committee really was that both of these bills have been worked on tremendously already.
Well, I think you said it right out. It was that we have new members on the committee.
Mm-hmm.
things have changed.
Well, they weren't able to hear everything all at once. But there
Again,
were-
it's a failure, having Zoom is kind of an awkward way of the process. So that's why we want to meet live and work on it live.
So if I might, we're sort of in the same dilemma on Senate Bill 68 as you probably are in the underlying bill, which we all support. And my understanding is that that bill also got caught up in 1234 last year, as did Senate Bill 68, or the earlier version of it. It was my bill last year, responsible for the government. I just think it'd be a darn shame to, not move forward with a bill that had, broad support, no opposition, especially once the out-of-state attorney had, the questions answered. It was written by Ms. Maliki of the Human Rights Commission, that we couldn't move forward with a bill because we're unable to have Zoom subcommittee. Which again, that to me I don't know. I feel like we're in a Samuel Beckett play waiting for Godot. The same thing happens over and over again on both the underlying bill and Senate Bill 68 without a reasonable explanation as to why we're not moving forward with it, because I think everybody would agree, at least I hope, that the way the bill is constructed, that there should be reasonable accommodations for pregnant employees. I suspect there's no opposition to that. There certainly wasn't in, the Senate here.
Did you have a subcommittee on 610?
We haven't had any subcommittees.
So how did it pass if these others don't pass? Because there's no subcommittees. They're in the same bill.
No, well, they're in the same bill because you put them in.
No, they're in the same omnibus bill last year that passed the House and the Senate.
610, in terms of, it was an omnibus bill because you put it into an omnibus bill. Okay, so so anyway, 610 is a banking department bill. It was a standalone bill. And so there was, in terms of, it's not about the omnibus and whether it's tacking in or not like that. It was that this issue had been addressed, it had been worked on. It started out as a study committee, and we had the issues resolved and things, that was a couple years ago. So it would really be a shame to have it die because you guys put all these non-germane amendments on a commerce bill that is a housekeeping measure.
If I could follow up, you just said that 68 and 69, even though they previously passed the House, in the same bill as 610, had to have a subcommittee. They were equally vetted as 610.
No, well, the difference being is that we obviously did have a change in committee alignments. We had an election.
No, I understand.
And elections unfortunately have consequences, so we had a lot of new members. So when it came to 610, the banking bill, the new members had no problems understanding and getting their arms around the issues. When it came to 68 and 69, the new members clearly were not ready
So let me,
to pass that.
if I could just be absolutely crystal clear, from a medical standpoint, from a healthcare standpoint, a lactating or pregnant mother who does not have accommodation cannot physically work in a place that does not provide that accommodation. Just want to be clear on that. So we are putting the fact that members are uncomfortable with pregnant or lactating women above a banking bill. And we're saying that's two different standards. And so you're asking us to pass a banking bill, which I fully support. They are equally vetted. And you're saying that your committee will, at the very least, delay action on this for up to a year because it would come back next session.
Yeah, you can put it in next. You can put it in again.
Well, it's retained. These are both retained.
Right, we're working on it. So we'll have it out in January. But if you weren't to be happy with what we come up with, you have every opportunity to put in your own bills. But to say that we're putting them lactating women above banking is
No, you're putting them actually below that.
below the banking.
Yeah.
So you have a lot of evidence that employers are doing this? That employers,
25, I'm telling you that 25% of women currently are unprotected by the federal lactating bills because of the size of the business. That's what this attempts to address, 69.
so the question we had was the only anecdotal story we ever got was actually the state agency. And so, I mean, are you saying that a lot of employers are not
I'm saying,
taking care of their employees?
I
We have
think what we're
evidence of
saying
this?
is, why wouldn't we
why
protect
wouldn't we protect
pregnant
them?
women?
Well, it's something because again, statutes are for when we know there's a problem that needs to be fixed.
But we also support.
How much evidence do you have that there's really a problem out there? That employers really are not taking care of their employees?
I'm not sure I follow, Mr. Chair. I think we do a lot of statute to protect people proactive,
Exactly.
to make sure that they don't have to, what you're asking women to do is if they do have a problem, they have to go to the governor's council or the state council. So it goes back to case by case. This is proactive. It says, no, we as a legislature, as a state, we respect the right of women to have a medical condition known as pregnancy or a medical condition known as needing to breastfeed my child. We respect that, and we don't want them to have to go and go through appeals and
Well, there's also a process no
Going to
matter what.
court. I mean, this is going to
Go to
court.
court.
This is to prevent them from having to go to court because Human Rights Commission has experience with the issues with the businesses. They work with mediators. They've got the experience, and this is to put that into statute.
And again, no opposition from the business community, none, zero.
In fact, they were on board.
Like I said, my new members of my committee were not prepared to. They
Well,
want
that
to work
seems
on
really
it.
unfortunate.
They want to work on
I mean, maybe the Senate is prepared not to cede to the banking.
it. It's your choice. It
request,
wouldn't be the
which
first time
is
you tell them.
unfortunate because, as you know, Senator D'Alessandro and I have led the charge on updating our trust laws. So, I mean, I don't like to be put in this position, but you're using process to undermine protection for pregnant women and breastfeeding women. And I think, I would suspect I speak for all three of us and all 24 of us that that's not acceptable.
To
And I
us, the
think we
process,
could make the same
process of
arguments
making
ditto
germane
on
amendments.
69. Again, no opposition. It's been broadly vetted. So,
By both chambers.
And we're here to help the people of New Hampshire. I mean, that's part of our process, and we get criticized when this kind of an impasse comes, and you're making it really difficult for us to meet needs that are there.
I think it's weird that you guys are using the word process because we don't like, in general, we don't like this process of non-germane
But you're hanging up,
amendments.
Mr.
saying-
Chair, all due respect, you're hanging up on words. This is, the intent of these bills are really important to the women of New Hampshire, and you want to stand in the way.
No, but women, I think most women are able to work it out with their employer. We don't,
It's not about
it's
most.
not about, excuse me,
Laws,
all women are
laws,
able.
laws
The
are
only
there.
one, there's only
to help
one woman
those that
I have
can.
we actually got the story.
Those,
Mr. Chairman, there are people shaking their heads over here who are
Well,
women. and
again,
they've actually
when
put
we
in the
get in
work
that subcommittee, when we retain the bill this September, they'll need to bring forward that evidence. And
for it.
show
I
us,
think they've brought it
show us
forward.
where the problem is. and how these
Ms.
bills-
Rose. Did I pronounce your name correctly? I'm sorry.
It's usually you guys have the time, you have no time.
Well, I'm on HB too, so my time is pretty short too. But
Okay.
I think this is important because, again, you're using process against protections for, pregnant women or breastfeeding.
I can assure you that yes, you're going to accuse me of using process, but that there was a majority of my committee, that was ready to kill these bills. And I convinced them that let's keep them and work on them. So you understand you're preaching to the choir somewhat to me when you're saying is, we need to do this. And I'm saying is, I certainly am sympathetic. It's not like this is the first time I've seen these issues. I think it's probably, as Commerce, I think have had this 3 or 4 times. So I just,
So isn't it time?
Chairman, I can speak to some of the evidence. So the language of this bill,
Could you sit there and turn the microphone on so that little people can?
so my name is Mrs. Royce, I can speak to some of the evidence. So the language of Senate Bill 69 is the result of 3.5 years of an advisory committee that was established in previous legislation that was passed. And so we were charged with coming up with language for this. And we did just what we were charged to do in that council, and it was to work collaboratively with stakeholders, and we did that. And the evidence is, in New Hampshire, 8 out of 10 moms initiate breastfeeding in the hospital. That's incredible. But only 3 of them are still breastfeeding fully at 6 months. And we know one of the barriers is returning to work. And so maybe you don't hear about the stories, but that's because moms don't have time to file a complaint and go through the legal process. Their milk will dry up in a couple of days, and so they're done. And for many of them, they need their job, so they have to choose their job. And so they keep working, and then they use an alternate source for their baby. But it's unfortunate that they have to make that decision. So we get calls. I work at the Department of Health. I'm a lactation consultant. So if you Google breastfeeding health, you will find my name. And so I get the calls, and while it's not my duty to support them in their legal efforts for returning to work, we do offer them education and support and where to go to get help. And so it's happening. The calls come in. Employers call me, HR staff call me. What is appropriate? What do I need to do? We help them. We have toolkits available. So I realize maybe you're not hearing the stories, but for those of us working in this field the last 10, 20 years, the stories are.
hopefully we'll get through this in September and October when we'll take these bills up.
Appreciate it. Our moms need the protection now, yesterday. So.
Can I just ask a general question?
Sure.
What's the plan for the Senate next year with omnibus legislation? There's a lot of resistance building in the House towards bills that have lots of different subjects in them. It's kind of out of the ordinary, but can we speak to the process next year, because it might make handling some of these things a little easier?
So let me just say this, when the legislature reconvened in December, we were facing 300 bills, 24 members, uncertain how Zoom was going to work for all the processes we had, all the public hearings that we had to get through. I regret that all of you found that process offensive, but we were trying to protect our staff, utilize to the best ability that we could the technology to get through the unprecedented workload that we had to get through. We got through it. If we had had 300 bills, you would have had even more problems than you had with omnibus bills. I think it's safe to say, as the majority leader in the House, that the pandemic's over. Blessings for that. Hopefully it never returns again, and we never have to use Zoom for the process again. Omnibus bills will be a thing of the past. That's my hope. That's my expectation.
And then the last one, the workforce housing one, again, the House did vote on it, and on Commerce bill, which gets to the idea of where the House has a problem on this. Bills went to go to the wrong committee.
So again, on this bill, there was broad support for it in the hearing process. Yes, it was an omnibus bill. As I indicated to Representative Ammon, the whole purpose of that was to be able to conduct hearings, in an orderly fashion. It was supported by the Municipal Association. It was supported by the Association of Realtors. There was no opposition to the bill. It was supported by Housing Action New Hampshire. Just to quote from Alyssa Margolin, who chairs Housing Action New Hampshire and represents 80 organizations, this was a program that had been unfortunately repealed in, I believe it was the 2011 budget. We are short some 20,000 housing units. It gives municipalities a better option, in how they deal with conservation, planning, zoning. There's funding for it. It just puts the initiative back on the books. So I see that, I believe some of the programs here, I thought there she is. So maybe you entertain a minute or two of her time.
Sure.
Talk about it.
I would, you need to come,
You have to come over to the mic.
Senator Bradley, I would just also add that it's enabling, not mandating.
Hi, everyone. This bill, Senate Bill 86, Part 2, originally it's basically the #1 priority of housing advocates this year. As Senator Bradley ultimately stated, we have a housing shortage of about 20,000 units across our state. I think we all know that housing is urgent in order for us to have our next generation here to keep our economy thriving. We need people to take over our dental practices, our accounting practices, our civic boards, everything that keeps Main Street, New Hampshire functioning depends on us keeping up with housing demand and making sure that young people are here. So this program is completely optional. It's something that municipalities can apply for. It's to support them. There's no budget asked for it this year. So it's really just to put the language back in statute. It has no impact on costs. So my hope is that given that it's completely optional for our towns and cities and that there's no fiscal impact from it, that this is something we can just put back into operation, and in future years then it's ready if we're in a different position and not in a pandemic to make a budget ask. Thank you.
Hey, John, question, just a comment for you. And I know you want to have your hearings and you want to have a process. So sometimes we run into in the court system, things aren't working out. The laws just don't take care of what's, so the court looks to equity to do the right thing. Sometimes you have to put the process aside. And I just can't see, especially in 29 and 30, those two sections, the SB 69, 68, the equitable thing to do is just go, maybe we didn't, it's an odd year. We had a COVID year, you couldn't get your hearings in, but they need the solution now. So could you not put the process aside and err on the side of what's right for women on these two?
That's just it. The bills are not dead.
No, they're not dead, but it'll be another year. You heard her testify. She needs the thing now. That women are calling now if they're not getting their needs
We
met.
need to do the right thing for the people of New Hampshire.
If it wasn't for COVID, you would have got your hearings in. So
Well, I would have had my subcommittee.
you would have had your subcommittees.
Subcommittee and bring.
So we couldn't do the process
many
correctly.
members along.
But just like a court that doesn't always have the law on their side, they can go to equity and do the right thing. So I'm asking you to try to do the right thing and maybe overlook the process a little
I've had my head handed to me.
bit. We all have that happen.
I think the
So-
women of New Hampshire might like to do that as well, Mr. Chair, if you don't act on
And
this.
that's
This
what-
is not 1 year delay, this is 2 years delay.
And
This
we've
was
been
in
asked,
the last
right.
year's making it
Now was the
through.
time to pass it,
And there have been
wasn't it?
a lot of people
Well,
involved
We
in
were in the
getting this
middle of a
right.
pandemic, and, I have to agree with my chair that we're holding up what is clearly a critical part of our policy that we make as legislators, because you can have subcommittee. It's not that it's wrong, it's not that it's bad, it's not that if it needs to be fixed, you can
We can
actually
fix
come back and you can fix it next year. You
Well,
can have it
that's, we
working.
don't generally do that. But yeah, I'm
we do
fully
do that.
confident
We do.
that we're gonna
It's
get
wrong.
it right. We'll figure out the right
But we
answer.
have it right.
In the meantime,
That was because you were in charge last session.
Well, and we can come back and change it if you need to change it, but right now, the people of New Hampshire are asking us to do it. We've had lots of testimony on it. We've had many people sign in as well. There's plenty of interest in this, and we are criticized when we don't listen to the people. And these are two bills that we can listen to the people.
To be frank, we're entitled.
And if you still want to bring it to the
69.
House, they can turn it
Let's
down.
talk about 69. I would say the first time I heard the breastfeeding issue, it's got to be over 10 years ago. So there've been plenty of opportunity for
And it took you a
when
while to get it.
Democrats were in charge that they could have gotten it passed.
Took
If
you
that
a
was
while
the
to get it
issue.
right.
I
But
don't-
all I'm saying is that right now I have a Republican committee that would very much like to spend a little time to make sure they go through the words and ensure that it is in their minds, it being fair to businesses.
Well, I don't think this is partisan, although you obviously do. I think this is about women. This is about equal rights for women, equity, parity. And by the way, the time frame was started several years ago. I believe it was by a majority Republican body where they put in place the advisory council, which is where this came from. So
I
let's be
understand.
straight and honest with each other. What's happening here is yet another year of delay. As you said, this has been going on for a decade. What's one more year? One more year is equity denied for women in New Hampshire. That's what it is.
I would say fundamentally that is your problem, because when you say equity and parity, okay, it's not. Because men don't have this problem, all right? And I certainly respect the fact that we want to treat women
But we have
with
wives
respect.
and we have spouses and
I
we have
understand that.
partners. So we do have this problem. It may not be in our own bodies, but
But
that's
it's-
one of the
the
reasons as a
issue
doctor
is-
and as a husband
The issue-
and as the father of children. I get it.
I hear you. All I'm saying is that I need to bring my committee along. I
But
need to help them see how we can get to the right answer here.
But if the House decides to non-concur, they can make another decision, but at least we can bring it forward.
No, I'm not holding the House position.
So if I could make a suggestion, why don't we reconvene tomorrow morning? You have an opportunity to think about all four of these bills and come back to us. Hopefully you will accede to some or all of them,
But
and then we'll
We're not-
accede to
we're
the
not
underlying
going-
bill. I think
we want to go back to the
should
original
sleep
bill.
as opposed to just saying no right now.
I'm certainly willing to come back.
I'm not going to change my position. So I don't know what the purpose of coming back tomorrow when I'm not going to change my position.
Because you would have a chance to talk to
And-
your leadership, talk to members of your committee. I think all of the bills are ready to go. Technically, they're fine. I don't think they need any amendments on them. I think what we're hearing is that this is a process problem. And I think what we're trying to say is we need protections for mental health patients, and we need protections for pregnant or breastfeeding women. And I think those all should override the process issues. I mean, we did the best we could with omnibus bills to ensure the process was smooth. You've had issues with Zoom. Okay, I get that. But show me where there's a problem in any of those three bills. I know I'm not as familiar, I will admit, with the land and conservation bill. I think Senator Perkins Boca did a good job of defending it. She was very articulate on the floor, and we fully support it. But and knowing how important affordable housing is, we ask your consideration on that too. And you know, we seem to be at an impasse. I don't like an impasse, but that's where we seem to be right now.
Well, I'm going to ask my other members of the committee, do you guys see room here?
And then there's another issue. We're talking about politically sensitive topics, right? And it's, those issues are good to raise money for a campaign. in addition to doing good. There's another, yes, I mean, I acknowledge that. But there's another position of not micromanaging businesses to do the right thing. That's another position where we're not trying to solve problems with mandates of businesses, but that, you know, having faith that society can work out these issues on their own without the heavy hand of government mandate. And that's an unstated position.
And I would not, I'd be on the same page as you if we had either opposition or suggestions from the business community about how to, you know, either fix or improve, or even against, you know, 68, 69, and 59. The fact of the matter is, we have no opposition, none, from the business community. Zero. So that's, I
Retaining the
think,
bill
the
gives
issue.
us an opportunity.
And I
to avoid
understand that, but what we're saying is, I think that, you know, the protections offered for mental health patients and pregnant or breastfeeding moms are pretty darn important. That's our position.
So in the committee, I took the business side and I played devil's advocate. And I was the one who kept saying, is this going to be an imposition on businesses? And they kept assuring me, and we went through every little detail of sufficient reasonable breaks. So it depended on the size of the business, and we left it as broad as possible to accommodate the employers and the employee. So it sort of was vetted already in the Senate hearing. I don't know if you read our hearing reports, but these ideas came up, and we are not at all putting any restrictions on businesses. Everything was left to, again, I love those words. They were the legal words I was looking for: reasonable and sufficient, to accommodate both the employer and the employee. And just think it's the time and place to do this.
I don't usually speak up too much. My problem with 68 and 69 is defining reasonableness. That bucket is so big that I think it needs more work to define that reasonableness.
So the reason we did it that way, so I brought up a pizza place in Sandown, because I was like, this is not good. It's going to restrict businesses too much. I said, what about my little shop? And they don't have any separate rooms and stuff. And so they're going to be able to work it out, whatever works between them and their employee. And then if they have a problem, they can go to the governor's commission. But we're giving both sides the opportunity to try to work things out first. So we're not putting the heavy hand of government in first. We're letting the employer and the employee try to work things out. And then if they can't decide what's reasonable, and again, one building's different than the next, so you can't have a one size fits all. That's why we use those general words.
I agree. But there is some more wordsmithing that needs to be done to ensure that every situation, just like you said, from the small mom and pop to the large corporations, are covered correctly. Just that one term doesn't make me warm and fuzzy.
Senator
Okay,
Whitley,
The Housing and Planning Commission, I'm not against workforce. I live in Derry. We got workforce housing. Londonderry doesn't have it. Raymond doesn't have it. Salem doesn't have it. And our school system is suffering for it. And collaborative care model, I was one of the ITOs. It was just not comfortable.
it is where medicine's going in every aspect. In gastroenterology, I started my practice 10 years ago at the request of 4 physicians. The whole concept is collaborative care. It means that it's much easier for a patient to get access. It means that it's less expensive, both on the system and for the carriers. And it means that one psychiatrist or one gastroenterologist, this isn't about gastroenterology, this is about psych, is able to see a much larger patient population because of the type of interaction they're having. So collaborative care is a medical term. It is a standard of practice in medicine. It is not happening in psychiatry the way it needs to. And that's part of the reason, when you look at our 10-year mental health plan, that's part of the reason why we don't have the services that we need to keep people out of the hospital, on the front side of the hospital, on the ER.
I understand about collaborative care. I go to Derry Medical Center.
It's great.
It's
great
extremely collaborative
facility.
care.
It is.
So
So mental health parity doesn't fix this problem?
I think
No.
that Senator Whitley would like to address the
Sure.
reasonableness argument
Yeah,
as an
yeah.
attorney.
Thank you. So I just wanted to address the concerns that you all raised, because certainly we have thought through those. And so I was not sponsored this year, but it has been worked on by many other senators. And certainly the Senate committee put us through our paces to talk about the concessions or the what we had done to the bill to address the business of the community. So on the definition of reasonableness, the DHHS had actually heard from businesses, and the task force had heard from businesses that they wanted an actual definition of what was reasonable. So that's why we actually defined in the bill what was reasonable, and that was based on the biology of a lactating mother. So that was something that was asked for businesses so they could have more clarity. So I wanted to point that out. And the other piece was, certainly we wanted to make this a solution that worked for New Hampshire businesses, like in the unique structure of New Hampshire businesses. So many other states, and 36 other states, have filled this gap and have a similar law, and they apply it to all businesses. But hearing from the business community, we said, okay, that doesn't make sense for New Hampshire. We're going to raise that threshold. So we did that for, employers with 6 and above. So, I think that just goes to show that this bill has been worked and worked and worked, and certainly this version of the bill reflects all of the concerns brought to us by the business community. So I just wanted you to be confident that this bill is reflective of the concern of the business community. Thanks.
So it seems like we're kind of stuck in that.
That's why I suggested that we recess till tomorrow morning at 10 o'clock and see if there's,
Nothing's gonna change on our part.
How about I leave you with the thought?
You can just,
Wouldn't it be nice if you got half a loaf rather than nothing coming out of today? Would you rather have nothing out of all these things? And I thought when we came here, we were open, right? Weren't we open that?
no, I
maybe-
wasn't.
Oh, okay.
I made it clear, right? Yeah,
Okay.
I'm here to give you guys a chance to express, how important these bills are
Sure.
to you. But that I've been doing this a while.
Yep.
And I've seen bills
That doesn't
die.
mean you're omnipotent.
Excuse me, I think I'm representing three people here. Okay? If they would like to say it, they could say it.
It's the House position.
This is the House position. And that, if it dies, it's unfortunate, but that was your choice to put these on. You didn't come and say, gee, Representative Hunt, how do you think your committee's gonna feel about it if we stick these bills back, on this banking bill? And I would have told you then that we're not tolerant, because then it turns into like an omnibus bill, but it's an omnibus Congress bill. But no, it's unfortunate for the banking department not to have this bill 610. It does seem unfortunate, strange that you guys chose this bill of all bills to load it up with non-germane amendments.
and it seems unfortunate to us that you're using process to undermine protections. But here's what I'm going to suggest. The way the process works now, as you know, Mr. Chairman, is that it's a House bill. So you get to write the report. You write the report any way you want. We would ask that you put some or all of the 4 bills in that report. Then it'll be our choice whether we sign that report if we're not going to move tomorrow.
If I tell you that the report's gonna say that the
I don't
Senate
care what
sinks
you
the
tell
House
me right
position.
now. I am asking you
And,
to since
go
we're
with the
not gonna
original
meet
bill.
tomorrow,
okay,
I'm asking you to reconsider your position and put in 1, 2, 3, or 4 of those bills, and then it will be our choice whether we sign it. Is that fair?
obviously, yeah. yeah.
Okay.
What was the record omnibus bill? I think one had 72 sections to it. Was that the all-time record?
Last year, 1234 had 77.
Okay.
That was last year.
2, 3, 4. So we need to reverse that trend.
And you know what? I agree with you, Representative, but
It makes it hard to parse out the different issues, right? Because
I think
one
these,
case the
I
other.
think these 4 issues are pretty clear. And it'd be one thing, we wouldn't be here if there was significant opposition to any of them. Wouldn't be here. So that's my suggestion. If we're not going to meet tomorrow, it's at your discretion as chair of the conference committee. Prepare the report in whatever way you're going to prepare the report. It'll be our choice whether we sign. It'll be Senator Morris's choice whether he replaces members if he deems that appropriate, or it'll die. We don't know. I'm pretty unhappy, to tell you the truth, at what I'm hearing. I'm a lot more unhappy right now than I was when I walked in here at 10 o'clock. The kind of arguments that have been used against killing these bills. So that's my suggestion.
68 and 69 are not dead.
They are
They're
here.
certainly not going anywhere right now, Mr. Chairman. and
So,
you
well,
both
you
know
got,
it.
my notes here says that you interim studied 638.
638.
Is it, am I reading this correct, Pam? Is it,
That was last year.
oh, that was last year. So this time it did pass from the Senate.
So
But how, and then, but what happened in the House when this bill came into the House?
I'm not familiar with that.
What happened to 638, Senate 638 when it came to the House?
Last year. I have no idea.
It was just referred for interim study by the Senate and that the end.
Didn't come to us.
So it never came to the House.
Right, because it was interim
Oh.
study.
Which bill are we
I'm talking about section 31, Senate Bill 638.
So if it was,
Establishing the New Hampshire Housing and Conservation Planning Program.
Right, that was last year.
Has the House ever heard this bill?
Yes, it was in Senate Bill 6, I believe. Yeah, it was in.
I'm
So
sorry.
you did hear it. It was in municipal and county.
And what happened to it on the House side?
I think the amendment stripped out the section part 2 of.
So the House position is that they were not ready to pass this bill.
That's correct.
And you're asking me to pass, is to disregard another
I am
committee?
asking you to reconsider your position of being opposed to all 4 of the bills. We're not going to get
You make-
everything we
This
want.
one's easy for me.
Okay, we're not gonna, I accept that, Mr. Chairman, you're not gonna give us everything we want. We're asking you, in particular, in the middle of a mental health crisis, and when pregnant or lactating mothers need protection, to at least reconsider your position on those bills, and maybe at a time that we need more affordable housing. I don't think there are any members here from municipal county unless
No.
you're all commerce. Well, maybe talk to the folks on municipal and county about the part 2 piece of Senate Bill 86, and prepare your report. Hopefully there'll be a little bit more flexibility than we're seeing right now, and then it'll be our choice whether we sign off.
Stand right here.
You are unmuted.
Thank you. We're resuming the committee of conference on House Bill 417. And Senator Guide, I noticed you've got a stack of papers there. What are you trying to say?
Senator Carson.
I texted her.
Okay, we were in the same place.
We
I
have,
remember.
we also have the amendment that I corrected after our discussion yesterday. And the House members have been discussing this, and if your amendment does not have a required affirmation or continuation of the state of emergency, we can't agree with that. Please, if you like it.
You folks have it, or?
Is this 199?
This
This is the one from, different one from
One line.
Senator Geiger.
is the,
Oh, no, oh, no, that's, okay.
Thank you very much.
If I got a couple copies of this, this is what you're considering now, this one?
we are looking.
Oh, you're looking at it, okay.
Chair, purposes of discussion, may I move?
Matt, yes.
Is it, forgive me as a newbie, but is it appropriate to, before we move, maybe do what we started the first time we met, which is Senator Guy had brought in an amendment and gave like a high level, gave the high level overview. Do we want to take that before we get into motions?
Well, that's what I was thinking about, because this has got a significant change, but it doesn't appear to have anything close to the House position, which is a vote to mandatory vote of the legislature to continue state.
Which I thought we had all agreed to yesterday.
The Senate was not ready to
Vote.
commit to vote on that, and apparently not to. But that's the House position. And although, it's nice to have constitutional language in this, you can argue the Constitution. I don't believe that's change, that's not moving toward what the House position is. I mean, the House has instead of requiring a approval every 30 days, we've said, okay, let the governor have 90 days before we have to vote. This does not require a vote of the legislature at any point. It just gives them the option, which is already possible. So it's nice words, but I don't think it makes a significant change.
I would appreciate it being voted down. Or, for lack of a second, perhaps it doesn't get approved.
I can't, I mean, the redress of grievances, I mean, I was here back in, I think, 2010 and 11. You had a committee, but I mean, the Senate would have to change their rules because we have no process for redress of grievances. So I don't even know how we would even begin to formulate that. So I thank you for trying to think a little bit outside the box on this issue, Senator, but I just see this making what is already a complicated issue even more complicated. And we wanted to try to be as transparent as possible with the public. So I just think that this makes it a little more complicated, but thank you anyway.
That's what, and this was intended to be fix the obvious errors in the current statute, which doesn't allow individual emergency orders to be addressed, and the fiscal issues. And we've got the fiscal issues down. That's, but I think that the mandatory vote in the legislature to continue a state of emergency is the House position. And we'll go out to 90 days. But I don't think we're willing to go for it. Anyone else?
Also, it does certainly complicate things, which is not positive.
I just think that the compromise that we've already offered is already so far from what the House passed by an overwhelming.
No, I appreciate your effort, but it's not the direct, I don't think it's the direction we want to go.
But the rest of it is the same. We just had to put everything into an amendment, that's all.
Yeah, no, it's got section 2 is still, it's the same in all.
Yep.
Said it was section.
It's in fact, it's C and all, C and D.
Right.
So if you would like to have a vote, we will vote it down.
Does it require a second to have a vote?
Yeah, it requires a second.
Is there a second? Okay, so we will not adopt that amendment. In that case, I'm going to move the amendment 1999H, which has a 30-day state of emergency. And then after 90 days, the governor shall call a special session and address us reasons, and then we have to vote to continue the state.
Second.
Further discussion? Okay, we will recess.
Can we make it 10?
Did you come directly from another meeting?
Yes.
Yeah, on Wednesday night voluntary ambulance crew.
Oh, this is
Everyone down,
yours.
yeah.
Where am I?
You're right there.
Oh,
And it was on, when I first came on, it was on Wednesday nights, and so we would watch it. every morning on calls.
oh, well, there's
And I used to say, this will be big, right?
Any further discussion? Accomplished. Senate.
Okay, then, in that case, I think we are unable to reach agreement and have to agree to disagree. Thank you very much.
Thank you
very much
for working so hard on this.
Thank you very much.
Thank you.
Thank you. Actually, I'm looking something else up. I saw you're actually at 18 community conferences.
Yeah.
So-
This is the last one.
Oh, good.
Yeah, and, yeah, but then I'm going to be here all day tomorrow, making sure people sign off on stuff, so. Carol, thank you